Hi, my name is Muhammad Tanwir Shah from Group 114. I want to discuss about COVID-19. Late December 2019, an outbreak of a mysterious phenomena characterized by fever, dry cough, fatigue, and occasional gastrointestinal symptoms happened in a seafood wholesale wet market in Wuhan, China. The initial outbreak was reported in the market in December 2019 and involved about 66% of the staff there. Coronavirus is a large group of viruses. They consist of a core genetic material surrounded by a lipid envelope with protein spikes. This keeps its appearance look like a crown. Crown in Latin called corona, and that is how this virus got the name. On the 25th January 2020, the first case of COVID-19 was detected in Malaysia and traced back to 3 Chinese nationals who previously had close contact with an infected person in Singapore. They had traveled into Malaysia via Singapore on the 24th January 2020. Every day, people are losing job and income with no way of knowing when normality will return. Until today, more than 250,000 cases has been recorded in Malaysia. The number of people who died also approached 1,000 people. However, the government is doing their best to deal with this situation.
Okay, hello everyone. Good evening. I'm Shalini S. Balakrishnan. I'm going to talk about what are the symptoms of coronavirus or known as COVID-19. Okay, the most common symptoms are cough, fever or chills, shortness of breath or difficulties breathing, muscles or body aches, sore throat, new loss of taste or smell, diarrhea, headache, fatigue, nausea or vomiting, and congestion or runny nose. Symptoms can begin between 2 to 14 days after you have been infected with the coronavirus. A study led by researchers at a school of public health shows that the median time for symptoms to show up is about 5 days. This is why the health department uses the 14 days quarantine period for people following exposure to the coronavirus. We can be infected with the coronavirus and have a cough or other symptoms with no fever or very low grade 1, especially in the very first few days. Keep in mind that it is also possible to have COVID-19 with a minimal or even no symptom at all. Early symptoms reported by some people includes fatigue, headache, sore throat, or fever. Others experience a loss of smell or taste. COVID-19 can cause symptoms that are mild at first and then become more intense over 5 to 7 days with worsening of a cough and shortness of breath. Some, they get pneumonia. The type of severity of first symptom can be very widely from person to person, and that is why it is important to call your doctor if you think you have any symptoms. Some people may never notice symptoms because they have a mild case. Symptoms of COVID-19 usually shows up 2 to 14 days after exposure to the coronavirus, but some people who are infected do not develop symptoms or feel ill. This is why it is so important to wear a face mask and practice physical distancing and hand hygiene. People can be infected with COVID-19 and not realize it, but still be able to transmit to other people. So seek immediate medical attention if you have serious symptoms, and always call before you visit your doctor or health facilities. Thank you.
My name is Morgana. My point is about the transmission of COVID-19 virus. In my opinion, COVID-19 can be transmitted when an infected person is in close contact with another person. When the infected person is in close contact, which is within 1 meter, this direct contact can cause the virus to spread faster. Firstly, this virus can be transmitted through aerosol transmission. Spreading of this virus can also happen especially at indoors, crowded or poorly ventilated spaces. The transmission occurs when an infected person spending long period of time with other people at places like restaurants, gyms, offices, or worship places. COVID-19 virus can spread from the infected person's mouth or nose in small liquid particles when the person coughs, sneezes, speaks, or breathes heavily. The liquid particles that spread from one person to another person are different in sizes. Next, this virus can also be transmitted through surface transmission. This is an indirect contact transmission. It can spread when an infected person sneezes, coughs on, and touches surfaces such as tables, handrails, or doorknobs. The surface will be contaminated with this virus, and other people may be infected by touching that surface and later when they touch their eyes, nose, or mouth without cleaning their hands first. This virus can live on the surface like plastics for 2 to 3 days. In order to stop this, we will need to clean the surface several times a day. Besides that, COVID-19 can also happen through airborne transmission. Research shows that the virus can live in the air up to 3 hours. This virus can get into a person's lungs if someone who has the virus breathes out and the other person breathes in the air. Through this, we can see that the transmission of COVID-19 virus happens mainly due to aerosol and close contact with the infected person. Thank you.
Okay, hello everyone. My name is Dewi Suryani binti Supraman. There are some tips of prevention to help protect yourself from contracting and transmitting COVID-19. Firstly, wash your hands frequently and carefully. Use warm water and soap and rub your hands for at least 20 seconds. You can also use an antibacterial and antiviral soap. Use hand sanitizer when you cannot wash your hands properly. Rewash your hands several times a day, especially after touching anything, including your phone or laptop. Avoid touching any part of your face or head, including your mouth, nose, and eyes. Also, avoid biting your fingernails. This can give COVID-19 chance to go from your hand into your body. Similarly, avoid touching other people. Skin-to-skin contact can transmit COVID-19 from one person to another. And additions, use a tissue or sneeze into your elbow to keep your hands as clean as possible. Wash your hands carefully after you sneeze or cough regardless. Okay, physical or social distancing also means staying home and working remotely when possible. If you must go out for necessities, keep a distance of 6 feet from other people. You can transmit the virus by speaking to someone in close contact to you. For now, please avoid to eat at any restaurant, coffee shops, bars, and other eateries. The virus can be transmitted through food, utensils, dishes, and cups. It may also be temporarily airborne from other people in the venue. You can still get delivery or takeaway food. Choose foods that are thoroughly cooked and can be reheated. High heat helps to keep coronaviruses. This means it may be best to avoid cold food from restaurants and all food from buffets and open salad bars. Okay, lastly, call your doctor if you have any symptoms. Stay home until you recover. Avoid sitting, sleeping, or eating with your loved ones, even if you live in the same house. Wear a mask and wash your hands as much as possible. If you need urgent medical care, wear a mask and let them know you may have COVID-19. Thank you.
Hi, my name is Ashwini and I'll be talking about COVID-19 vaccines. Vaccines save millions of lives each year. They work by training and preparing the body's natural defenses, the immune system, to recognize and fight off viruses. So I'm sure many of us wonder how vaccines are actually developed. As with all medicines, every vaccine must go through extensive and rigorous testing to ensure it is safe before it can be introduced in a country's vaccine program. An experimental vaccine is first tested in animals to evaluate its safety and potential to prevent disease. If the vaccine triggers an immune response, only then it is tested in human clinical trials in 3 phases. Under phase 1, the vaccine is given to a small number of volunteers to assess its safety, confirm it generates an immune response, and determine the right dosage. Generally, in this phase, vaccines are tested in young, healthy adult volunteers. Under phase 2, the vaccine is given to several hundred volunteers. Participants in this phase have the same characteristics such as age and gender. There are usually multiple trials in this phase to evaluate various age groups and different formulations of the vaccine. Under the last and final phase, phase 3, the vaccine is given to thousands of volunteers to determine if the vaccine is effective and to study its safety in a much larger group of people. Most of the time, phase 3 trials are conducted across multiple countries and multiple sites within a country to ensure the findings of the vaccine performance apply to many different populations. There are currently more than 60 COVID-19 vaccine candidates in clinical development and over 170 in preclinical development. When a safe and effective vaccine is found, COVID-19 vaccines global access, also known as COVAX, will facilitate the equitable access and distribution of these vaccines to protect people in all countries. Thank you.
A very good evening to my dear fellow friends. The COVID-19 pandemic has significant impact all of our society on our day-to-day life, especially those in poverty or economically challenged. It has stretched all our support organizations and unmasked the failure in our system to support individuals and families. The COVID-19 pandemic has evolved in health and social economic crisis on a very huge scale of impact. The situation in Malaysia is compounded by the fact that government came into power only early March of 2020 and is already facing a heavy debt, financial constraint and knock-off effect on trade and tourism from the global shutdown. As per our discussion today, I will discuss two major impacts of COVID-19. First and foremost, while there is no way to tell exactly what the economic damage from the global pandemic will be, there's a world spread agreement among economists that it will severe negative impact on our global. Early predict that before the coronavirus become a global pandemic, major economies will lose 2.4% of their value over 2020. Leading economists already reduced their 2021 forecast of global economic growth. However, these predictions were prior to COVID-19 becoming global pandemic and before the impact of the worldwide spread of restriction, social contact to stop the spread of the virus. Since then, global stock market has suffered dramatically due to the outbreak. Secondly, the year 2020 and 2021 was undoubtedly a tough one for the job holders as the COVID-19 pandemic and accompanied by the lockdown hampered business activities, causing many businesses to shut down and their employees to lose their job. According to Human Resource Minister Dato Sri M. Saravanan, since the Movement Control Order MCO was implemented on March 18, more than 99,000 Malaysians has lost their job. Malaysian unemployment rate hits 55.3% in May. It is the highest level in more than 3 decades. Data from the Department of Statistics Malaysia shows the number of employment person rose from 300,000 to 800,000. Hardest hit was those in the service industry, in particular those in tourism and hospitalities. The year also shows many hotels fallen victims to the COVID-19 and had shut down for good. The casualty include G Hotel in Kuala Lumpur, Mercury Beach and Gurney Resort Hotel, resulting in sizable job loss. Malaysian-based airlines such as Air Asia, Malindo Airways also let thousands of employees as the fleet remaining ground because of the pandemic. In a nutshell, from our discussion, we hope that this pandemic ends soon so we can go back to our normal life and hopefully we can adopt the new norms. Together, we stay strong to fight this pandemic. Stay home and stay safe. Thank you.